Hey guys, how are you? Welcome back for the semester. Welcome to OCC 460 or Integration Across the Lifespan. You have to be so excited starting your last semester in your baccalaureate year here at CUCA. This is a really fun course, so I want to take a few minutes to share about how we're going to be doing the labs throughout this semester, okay? So what I'm going to do is I'm going to record an ed puzzle, which you're all familiar with, and post that online about a week before the lab will be held. You're going to be asked to review the presentation prior to Wednesdays at noon of the week of the lab, and you need to answer the questions that it will be specified in the presentation itself. In addition to that, I'm asking that you create one complex question that would be expected from a questioning point of view as a senior in college about the content. So this is, what are you curious about? What else could you think about? Kind of get out of the box a little bit and think a little deeper into the subject, or look a little deeper into what the video is showing, or look a little different into the cases that we're going to be talking about. Please bring your laptop and or print out any materials that you would like to have to keep notes on prior to lab. For this week, anything that you'll need to have in lab, I will provide to you. And as the third bullet here says, some materials will be provided to you in lab, and I will specify that during the presentations itself. In labs, we're going to review general information presented as needed to engage in the lab activities. What that means is the questions that you post on the ed puzzles, I will be using those questions to create a dialogue or to have a springboard for discussions in the lab presentations. I'll be sharing student feedback from those as well, and I will also be randomly asking students to share what their question was. So make sure you're prepared for that. You're going to be working in small groups, or you're going to be working with partners. And the lab time now, instead of being a teaching time, because we're doing these ed puzzles instead, the lab time is going to be used to hone your clinical reasoning skills, your clinical skills, and to ask questions and be curious regarding your individual cases as we get further into this semester. So let's get started in talking about what clinical reasoning is and what we're going to be doing this week. This week, we're going to be looking at clinical reasoning skills when reviewing medical and developmental information. So I don't know if you, when you were on your level 1 fieldwork experiences, you hopefully had the opportunity to look at either a medical record or a developmental record. And I hope you kind of said to yourself, holy crap, how am I going to remember all of this information? There is so much stuff here. Part of clinical reasoning is identifying what information is pertinent that you need at this moment. What do you need to know in the future? And then what is the past information that the client is bringing forward that is also important? That's part of those skills. So we're going to be looking to identify this information. We're also going to be looking at who looks at this information on these clients. What information do different professionals need that maybe we do or don't need? And then we're also going to talk about that reports, anything that is written or documented, because nowadays a lot of times they are electronic health records or electronic medical records. Anything that is in this information is legal. And I'm sure that you know that, but we're going to talk more about that as well. When you're in class for the first lab, you're going to be pairing up and we're going to be completing a clinical reasoning worksheet that really looks at how to review medical and developmental records. We're going to be using a document out of Dr. Smith's book, OT, Transition from the Classroom to the Clinic, and I will be bringing a copy of that with you. Within this format, we're going to be talking about information that is subjective, objective, what is assessment or appraisal, like what are you trying to identify, or there's another word I'm thinking of, interpretation. And then what is the plan? Okay, I know you've looked at SOAP notes. So we're going to be using the general content with the subjective, the objective, the assessment, interpretation, and plan to be talking about that. So what I want to do is take a minute to kind of give you some reminders about what subjective is. So when you're talking about subjective, these are things that a patient says, right? So my throat is sore, or maybe my body hurts, or I haven't been home for 4 days, or my child is sick, or I am ill, or I hurt. These are all subjective information. These are things that patients say, and often we can put them within quotes. Other information, such as patient's medical history, like past medical history, past surgical history, past social history, should also be indicated at this point. So, for an example, you might say, patient has a past medical history of COPD, an MI, CAP, or I'm sorry, CABG, those types of things. And we're going to talk about some of those in class or in lab as well. Under the objective information, these are physical observations that you see about a patient. What does the person look like? What is their appearance? You could put vital signs in here, right? That's objective information. If there was any tests that you completed, any assessments that were done, okay? So maybe medical test, maybe an x-ray results, maybe blood work that was done, vital signs that was done. Things like that, that's all objective information. Developmental testing, okay? If you're working with a child, what was their psychological test? What were the results from that? What is their GPA? What are their grades in school? Okay, that is all objective information. The assessment is the interpretation. Okay, this is, I'm sure you've heard that term before, but the assessment is now the interpretation. So you take any objective information that was identified through medical record, or I'm sorry, through medical documentation, through educational documentation, and now you interpret it. Why is the individual having difficulties? Because of what happened in O. Okay, so now this is the interpretation. This is what's happening. This is why we're seeing what we're doing. This is why the individual needs further evaluation, X, Y, and Z. Then when we get to the plan, this is what the health professional or the educational professional plans to do about it. So what is the plan for this child in school? What is the plan for this therapy session? What is the plan for the medical professional to be working on? Okay, so anything that you find in a medical chart will follow the same format as like a SOAP note, okay? But again, it's not just our information, it's any of the information within the medical chart. Again, we're going to be talking about this in class. I'm going to have a worksheet for you, so it should be really kind of a fun day. But please review the information about subjective, objective assessment and plan prior to coming to class. Next week, so the second week of lab, we're going to be going over quick screens. I know that you did this with Dr. Christensen, I think, or maybe Dr. Bennett, not really sure who. So we're going to be reviewing what is range of motion. Why do we do range of motion? What is manual muscle testing? Why do we do it? Then we're going to be adding the higher components of clinical reasoning skills. What are you looking at? What are you seeing? What do you need to know more about? In lecture, we're going to be talking about specific components of clinical reasoning that we'll be using throughout the semester. So that should be really fun too. So look for the next video or the next presentation. The next presentation will, however, have a video in it that you'll have to look at. So I think that's it for now. I'm excited. I can't wait to see you in a couple of weeks, and we'll talk to you soon. Bye-bye.